it's the old saying of the machine does what it was designed to do. And, originally the health records we had in paper were to keep track of every individual decision we made at the moment. And the EMRs pretty much did that electronically. They did a little trending over time with blood pressure, and a little aggregating over time in sortable ways with the meds. But they weren't structured and didn't have the mechanisms to summarize all that care over time, but they really were really good at recording information. So it's kind of a double-edged sword. We ended up with a lot more information recorded than we could synthesize in a consumable manner. And that's the opportunity here for the first lower level of AI. And frankly, sometimes I find it harder to click to find information than I used to find it to flip a page to find information. And I am seeing with some of the AI aggregation, it's actually a little better than flipping and turning the page. It's a step forward after a bit of a step back.
Yeah, yeah, I think yeah, I have a friend of mine who's also a physician said, there's nothing is faster than scribbling a note, and that's like
Mhm.
that's true. And I'm often reminded that the most secure clinical record was a paper record for two reasons. One, if you needed it, you couldn't find it, and then if you did find it, you couldn't read it. So you can't get much more secure than that. Uh, I do think I agree with you that I think we haven't. When we think about an electronic health record, they really are still working off of a paper metaphor than as in terms of where the way we capture data, we think of a treatment plan as a point in time when it ought to be a dynamic thing that changes over time, maybe in real time that we take, we do an assessment every 6 months rather than continuously assessing things, which would be difficult without automation. But I do think when we look at like mining longitudinal data for a particular client, first of all, for a particular client and say, look, we're seeing trends. The AI is finding trends here that we would not have caught for that particular person, and then aggregating across patients and looking at kind of larger trends. I think it seems like there's opportunity there that we really aren't taking advantage of.